Finally, a comprehensive approach to COVID-19. So many of you have been hit almost every other week with the new miracle drug, with the latest vitamin, with the latest practice, the latest kind of mask and so forth. We've been going at this for over a year now. This hit, depending on where you start, December or January, more than a year ago. And there have been so many slapdash studies done, and I've been covering them on my YouTube channel, Citizen Zeus, and also on my website, citizenzeus.com. And I encourage you to look at those. But I'm going to do a much more succinct version of the more extensive research that I've done right here, going through all the different phases, kind of following the COVID-19 virus, the Sars Cov2 virus, sort of into our system, and in every level what it is that's happening, and then at every level what we can do to either counteract it or help our bodies support our immune system or our way of addressing it. What's not really often said with all the talk of vaccines and so forth is that often what happens is that these viruses come and make a challenge to our body, as well as provide information. And that creates chemical reactions that use up a lot of the things that we need, including vitamin D, etc., creating deficiencies. If these deficiencies aren't addressed, oftentimes that virus can go through and cause death or can cause serious hospitalization and illness. So by not treating the virus simply as an enemy to be shut down, but knowing that there are certain things that can keep it from functioning optimally and can keep you functioning far more optimally, we can go ahead and follow those steps and not only interrupt transmission and replication all the way through our system, from initially breathing it in to having it embed into our lungs, our throats, and even upper respiratory tract, to the ACE2 receptors and other kinds of things that links up to the furin cleavage site that gets it into the cell, and even ways to prevent replication once it gets into cell. And at the very end, even after the viral load has gone down, it looks like your body has done it. COVID-19 has a very interesting and unique profile where it can create inflammation 20 days after, 19 days after, and even have mortality and death and problems with inflammation then. So I've gone through the different steps and I'll put them in the corner, and I'm going to try to keep this brief, less than 20 minutes. There's a lot to cover, but I'm going to try to do it very, very briefly. So again, finally, COVID-19 gets a comprehensive practical analysis, countering SARS-CoV-2 at every step. The first has to do with general knowledge about keeping our general immune maintenance and support up. Basic lifestyle considerations will automatically put you on the many floors above the danger level, okay? Again, these are not replacements for any decisions you make about vaccines, and this is not medical advice. I'm bringing together research to help you understand this in a more comprehensive and integrated way, to both beef up your own system and also understand what can counter this virus. So the step 2 is presenting physical barriers to the SARS-CoV-2 infection. Let's look at mask, physical distancing, and also what kind of, like for instance, oregano oil and other kinds of things can help prevent this virus from getting into your system and lodging to begin with. Barriers that prevent infection or less the amount that you take in. Then there's preventing the SARS-CoV-2 from embedding in your lungs and epithelium. That's where it gets its foothold. And related to this is addressing and balancing ACE2 receptors versus the ACE2, which is with a Roman numeral 2, very confusing. But the ACE2, the Roman numeral one, is the one that is the one that amps you up. And if it gets out of control, it gets dangerous. And the ACE2 with the Roman numeral, with the Arabic numeral 2, is the one that can help counteract that or balance it. Finally, once it does get in there and lodges in your body, it has to get into the cell. And it uses this kind of furin cleaving site. It's a protease or a protein that allows it to get more easily through the cell wall. There are ways to interrupt that. Once it's even in the cell, there are substances, namely dark chocolate, green tea, and mescadine grapes and cocoa, that can actually muck up the protease that causes replication of the SARS-CoV-2 virus in your cell. And then finally, even after all this is done, your immune system has responded, your viral load is going down. There's still a little bit of danger about certain acquired immunity overamping, creating inflammation and creating danger to your health as well. We will address all of these step by step and bring in the latest research at every turn. So let's go ahead, and I'm going to put myself in the corner right now. And we're going to go ahead and, let's see here. Let's go ahead or put me in the corner. Okay, we are in the corner. Okay, and let's go ahead and go on to this. I'm going to see if I can get this down here. This is preventing me from clicking quite onto it. Okay, here we go. Let's go ahead and click on here. Okay, guys, we're going to have to get you off of there. There we go. I do want to help put this in. There we go. I'm going to go ahead. Maybe I'll put it up a little bit so that we don't have that covered up. Okay, here we go. Okay, this first one is from, again, an NIH article, National Institutes of Health. Again, most of this is from fairly mainstream publications, including quite a few scientific and peer-reviewed publications. Number one thing you can do is sleep. COVID and sleep, better slumber during the pandemic may protect your health, No, definitely protect your health. How and why? At the molecular level, studies show that the poor sleep, and I'm reading here, disrupts the immune system by interfering with disease-fighting factors, including certain proteins called cytokines. Again, so much of this has to do with our body amping up, either in the immune response or even in life. Stress, anxiety, as well as immune response to some stress. And having no ability to bring it back down to rest, restore, and regenerate the body. Sleep is absolutely critical for that. Cytokines are an inflammatory signal. And if they can't come down, and sleep helps bring them down, you end up with chronic inflammation and all kinds of degenerative diseases, not just more risk for COVID-19, but any kind of long-term chronic diseases, hypertension, heart disease, and so forth, cancer as well. So it's very important to understand how important sleep is. It also helps your immune system recover and become stronger. And that's all kind of shown here in this article. The National Geographic put it very, very succinctly. If you want to reduce your COVID risk, you need to sleep more. So I'll pull this on over a little bit. So here we are. It just goes ahead and shows exactly why, the history of sleep. I won't spend a lot of time doing that. Most of this should be fairly obvious to you. How about hydration? Hydration, super critical. Good hydration allows your blood system, again, this COVID virus is not just a respiratory virus. It also has an HIV-like mutation, which makes it a blood immune nerve virus as well. That's already been understood by traditional science. So suboptimal hydration, that is not drinking enough, not getting enough water or fluids in you, is associated with key risk factors for COVID-19 mortality, including older age, male sex, race, ethnicity, and chronic disease. So these underlying problems, they call them underlying conditions or risk conditions, are accentuated with poor, what they call water balance. When your body has adequate hydration, the cells can become, in some sense, more able to exchange nutrients, exchange the things, get out waste products. Blood is more easily able to flow. Your body is not in a stress response for lack of water. Okay, so again, it's an easy foul to avoid by simply making sure you get enough water. Could changing our diets defeat COVID-19? Diet, incredibly important to your immune response and incredibly important to overall health. This guy is Dr. Colin Campbell, PhD. He did the famous study in China and wondered why cancer and other chronic degenerative diseases were in localized clusters. And what he found was this, with another virus, hepatitis B virus, and again, a lot of this virus stuff can be transferable to other viruses. They collected data on the prevalence of people having antibodies and antigens, multiple disease mortality rates, and many nutritional risk factors. Relying only on statistically significant findings, HBV, that's the hepatitis B virus, antibody prevalence, was highly correlated with vegetable consumption, dietary fiber, and plant protein. In short, more plant food consumption was associated with more antibodies. Now, if you have different genetics and you find that you tolerate meat somewhat better, it's still saying whole food, mostly plants. And then the more plants, the better, at least in this study. Among the exceptional high number of virus strains, each virus creates its own unique symptoms, but they share something in common. That is, they invade hosts like us and our immune system, which adapts for each virus strain, mounts a defense, most commonly by custom making antibodies for each virus. So in their research, they found that people consuming more animal protein had fewer antibodies, even in those consuming a very low amount of animal protein. So there seems to be some risk factor associated with consuming meat, but if you do consume meat, this would suggest do it in limited quantities because it can affect your immune response. And the last line here is, I believe that this consistent interplay of nutrition, virus activity, and disease should apply to COVID-19 as well, especially for older individuals compromised by diseases arising from the same nutrition that decreases antibody formation. So there is a link here between antibody formation and overall health. At least he's making that link. It's not necessarily a researched link, but he's had a lot of experience with this. Exercise. Exercise is absolutely critical. I've always been noting why so many of these athletes, high school, college, and pro, they get this COVID, they test positive for COVID. A week later, practically, they're back on the field. I said, is there something about this exercise environment that's preventing this from going past a mild to moderate phase for these athletes? There are, of course, a couple anecdotal examples of a couple of athletes who have gone to a more dramatic phase, but this is very, very rare. What's going on here? Well, this doctor here, what's his name here? Dr. Zhen Yan of the School of Medicine showed that medical research finally strongly support the possibility that exercise can prevent or at least reduce the severity of acute respiratory distress syndrome, which is implicated with COVID-19, which affects 3 to 17% of all patients with COVID-19. So what he said is, all you hear now is either social distancing or ventilator, as if we all can do is either avoiding exposure or relying on a ventilator to survive if we get infected. Leon said, quote, the flip side of the story is that approximately 80% of confirmed COVID-19 patients have mild symptoms with no need of respiratory support. The question is why? Our findings about an endogenous antioxidant enzyme provide important clues. Now, what is this enzyme? It's an enzyme created through exercise. He's the director, by the way, of the Center of Skeletal Muscle Research at University of Virginia's Robert Byrne Cardiovascular Research Center. No slouch here. He compiled an in-depth review of existing medical research, including his own, and looked at an antioxidant known as extracellular superoxide dismutase. This potent antioxidant hunts down harmful free radicals, protecting our tissues and helping to prevent disease. Our muscles naturally make this, secreting it during the circulation to allow binding to other vital organs. I'm still reading here. But its production is enhanced by cardiovascular exercise. A decrease in the antioxidant is seen in several diseases, including acute lung disease, ischemic heart disease, and kidney failure. So, again, we see the relationship here. Diseases take a toll and they sap these nutrients and these beneficial enzymes out of the body. And enhancing our health through sleep, through hydration, through exercise, etc., and through certain kinds of supplementation and eating the correct kind of foods, brings those things back in. If we have the deficit and the challenge, and we don't do the things to counter that or balance that, to create equilibrium with wise nutrition, wise supplementation, wise exercise, and wise application of knowledge as to what will interrupt the replication and instantiation of this virus in our bodies, then we put ourselves at risk. So we have a lot more control of this than we think we do. And exercise is one of those things that have always interested me. Why so few athletes seem to be getting this? It could have a lot to do with what Dr. Jan is saying here. And finally, research suggests that even a single session of exercises increases production of the antioxidant, prompting Jan to urge people to find ways to exercise while maintaining social distancing. We cannot live in isolation. Again, one of the unintended consequences of lockdown is that people, a lot of them, have not gotten their proper exercise. And that's critical to the maintenance of the body and the treatment of the disease, not to mention mental and emotional health, and just driving you crazy by having to sit together. You can't binge on Netflix forever. And I'm sure that there is no research link between Netflix binging, as far as I know, and anti-COVID-19 protocol. So another thing that has been shown to have a statistical and research link is intermittent fasting is a possible priming tool for defense against SARS-CoV-2 infection. Now, intermittent fasting in its simplest form is that you don't go for a long period of time doing it. Usually you just restrict your hours of eating. A typical one would be you don't eat until 10 o'clock in the morning, and then you don't eat after 6. So you have like an 8-hour swing in the middle of the day. You only eat then, and you let your body rest the other 2/3 of the day, or the other 16 hours. Okay? We've already known that overeating creates these really problematic acidosis type of situations in the body and depresses the immune system. What we're seeing with intermittent fasting is that the opposite is also true. It's not really under eating. You're eating just a normal amount of food, but you're packing it into fewer hours, and you're letting your body rest and recover for more hours. Actually has beneficial effects on the immune system. So here are the highlights. I'll just go ahead and read them. Immunosuppressed individuals are particularly at risk for SARS-CoV-2 infection. Intermittent fasting may prime the host immune system. So especially if you're immunocompromised or suppressed, fasting can actually help accelerate or accentuate it. Intermittent fasting activates autophagy, a cell surveillance system that boosts up immunity. So it actually activates specific components in your immune system. And finally, intermittent fasting may constitute a promising preventative strategy against COVID-19. Again, you see how this is an integrative approach. As we bring these practices together, we can develop a kind of checklist, and we can define and experiment with the ones that work the best for us, if we can't do all of them, because there are quite a few here. And at least we know where they're getting us. The benefits of meditation and mindfulness. Again, in high stress environments, especially over long periods of time, the ability to take that, cranking up that anxiety, that fear that's being so produced here, the dislocation, and creating a practice of meditation or mindfulness where you use breathing, where you begin to calm your thoughts, become absolutely critical practice. And very few people let themselves sort of understand this. Here's a relevant phrase that I picked out that, quote, the predominant symptoms presented at this time in many of our patients in society and in ourselves is anxiety, overwhelm, and despair. These are natural sequelae of existing in the time of a global pandemic of what will be an uncertain duration. Okay, we don't know when the end will be. Systematic reviews of meditation-based tools such as meditation using focused attention, some of these other methods and so forth, reduce anxiety, depression, and post-traumatic stress disorder, stress, blood pressure, cortisol levels, and other physiologic markers. Using the mind to calm the body has chemical effects that improve your immune system. Okay. I went ahead and just copied this onto I put the URL there in the article because it was sort of messing up my system. It was one of these things that had too many cookies on it, and it was really eating up my my CPU. But here's another thing we knew. Coronavirus appears to die quickly in direct sunlight. The military researchers were already finding this to be the case. Again, some of these were senior research scientists at the Department of Homeland Security's Biodefense. So these people know a thing or two about bugs. And here's what they had to say. What we have found so far is that sunlight seems to be very detrimental to the virus, Davish explains. And so within minutes, the majority of the virus is inactivated on surfaces and in the air in direct sunlight. Research done at the National Biodefense Analysis and Countermeasures Center was first revealed by William Bryan, the acting Undersecretary for Science and Technology at Homeland Security. He described, quote, the most striking observation to date that ultraviolet rays from the sun may have a powerful effect on the virus. During a White House briefing, Bryan reported the virus is dying at a much more rapid pace just from exposure to higher temperatures and just from exposure to humidity. So sunlight, higher temperatures, and humidity seem to have a significant effect on this virus. Now, as I've noted in another video that I've produced, and I'm actually going to reshoot that one. I haven't released it yet. But so much of this virus seems to be indicating either lab creation or lab alteration, because the natural aspects, sun, air, humidity, heat, those things you wouldn't find in a lab, which is cool, artificial light, dry, tend to throw it off, tend to either destroy it or it's not equipped to handle. So we'll go here. Again, one of the things that is driving me crazy is how people, even when they're dispersed outside, are wearing masks still. And I'm still in favor of masks, especially in close quarters. There have been good research around that. But outside, in exercise, away from other people, it's simply not necessary to wear masks in that way. In fact, when you're outside, this is again from Mayo Clinic, fresh air is constantly moving, dispersing droplets that kind of carry this COVID stuff. Now, these COVID is an aerosols that go beyond droplets too. They're very, very small particles that can suspend in the air. That's why but they do ride out on droplets. So you do limit the spread when you do have a covering that prevents those droplets from going through. But if you're away from other people and you're outside, really, it's really good to have that air, take that, disperse it, and do your exercise. So you're less likely to breathe in enough of the respiratory droplets when other people are around you too, containing the virus that causes COVID-19 to become infected. But be sure to wear a mask when you can't maintain distance from others. If you can, don't. Okay, that's what it's implying. Okay, being outside offers other benefits too. It offers an emotional boost that can help you feel less tense, stressed, angry, or depressed. And the sunlight can give your body vitamin D, a very critical vitamin when it comes to fighting COVID-19. So what about probiotics? Well, using probiotics to flatten the curve of coronavirus disease. Yes, probiotics are also helpful. In fact, here's what this peer-reviewed article has to say from Frontiers of Public Health. Probiotics are live microorganisms that, when administered in adequate amounts, confer a health benefit on the host. Probiotics are beneficial bacteria that help your gut health and also help your entire body be more balanced, including your immune response. Clinical evidence shows that certain probiotic strains help to prevent bacterial and viral infections. Viral infections, including gastroenteritis, sepsis, and respiratory tract infections. That's exactly critical to the whole COVID-19. The reason for adding probiotic strains to the overall prevention and care strategy is founded in science and clinical studies, albeit hitherto none directly on the etiological agent of this pandemic. What they're talking about is Sars Cov2. But they have been practiced on other viruses to great effect. So there's good indication that they would have some beneficial effect in terms of helping to deal with COVID-19. Now, what about face masks? There's been some controversy around face masks. My own particular view on face masks is simply this: go with the science. Definitely when you are packed indoors, first of all, you shouldn't stay in the same place and with the same people indoors. If you're shouting, yelling, breathing hard, like if you're doing intense exercise right next to each other for a period of 15 minutes or longer, you probably will expose other people and yourself to viruses if you are infectious at that point. And sometimes you can't even tell from symptoms, okay? If you are outside, and you're not near other people, especially if there's a breeze there, and especially if there's sun. Much, much different story. In fact, I have a gym that has established one of those things outside. And most of the people are 6 feet away from each other and are not wearing masks. The fact that they're exercising, that they're outdoors and have that air, and the fact that they are maintaining that social distancing allows that extra oxygen and ability to do that. Now, if you wanted to be really, really sure, you could wear a mask even when you're exercising, but the risk is much lower. It's not zero, so it's always a matter of choice, okay? But when it comes to mask wearing, especially around other people, and some people even put crowded city sidewalks outside, okay, as this, and some towns have even made that when you're in downtown, they want you to wear a mask even on the sidewalk. I usually just try to hold my breath if there's just a few people as I pass them. In fact, it's great for intermittent breathing, which is actually quite healthy as well. So here's what the evidence says. The preponderance of evidence indicates that mask wearing reduces transmissibility per contact by reducing the transmission of infected respiratory particles in both laboratory and clinical contexts. Public mask wearing is most effective at reducing spread of the virus when compliance is high. That's when everybody's doing it. Given the current shortages of medical masks, we recommend the adoption of a public cloth mask wearing as an effective form of source control. I've heard studies that that masks can be as low as 5 to 10% effective, but even that is significant when it comes to limiting spread. Now, we may actually all have to eventually be exposed to this, but remember, the whole point was to lower the curve so we don't overwhelm hospitals, and we keep it away from the most vulnerable. And masks seem to be contributing to that. So I don't ultimately have a problem with that. So here we are. Can nasal breathing reduce your risk of COVID-19? The answer is yes, on a lot of levels. I will just summarize this, okay? The benefits of nasal breathing. Mouth breathing exercise activates upper chest expansion. Not good, okay? Limiting the flow of air to the alveoli. Now, what about nasal breathing, okay? Breathing through the nose is associated with diaphragmatic breathing. That's breathing from down in your gut, bringing air down into the alveoli in your lungs, increasing blood oxygen levels, very important, because those are the levels that fall during COVID-19, as well as particle filtration through the nose and the hairs, removing contaminants. Nasal terminates warm and humidify the air. So it warms the air and humidifies it. Again, we know that the viruses don't like warm and humid air, okay? As it moves into the lungs, and the contrast, oral breathing is drying, both to the respiratory system and to the body, increasing dehydration and inflammation. So nasal breathing, very important here. Furthermore, tonsils and adenoids become the primary filters during oral breathing, causing them to enlarge and obstruct airflow. Again, by making your nose the breathing, it's creating nitric oxide, it's filtering, it's warming, humidifying, okay, right? It's creating a barrier. Just like your mask, your nasal breathing is doing the same thing. An additional benefit of nasal breathing are the effects of nitric oxide. Nitric oxide is a vasodilator and bronchodilator with potent antimicrobial effects. So it opens up your system, allowing for better oxidation and better flow of blood, all these things. Nitric oxide tonifies your blood vessels, tonifies the endothelium where these viruses attach, okay? And becomes very good also at creating a vagal response that is creating the sympathetic or calming response on the body. You'll notice that anytime you do that, and here's a great way to do it, they call it the 6-7-8 method. You breathe in through your nose, 6 seconds, hold for 7 seconds, and out through the mouth. By breathing in through the nose, you're bringing in that nitric oxide. By holding it, you're creating this calming response, okay? And by releasing it through your mouth, you're not blowing out the nitric oxide, okay? So by doing this, bringing nitric oxide into the lower respiratory system where it continues its antimicrobial activity and improves oxygen uptake. So it's helping that nitric oxide, it's getting down there in the lungs and in the alveoli, really getting at where a lot of this COVID-19 virus attaches and hyperoxygenating the system. You're getting at least 2 to 3 or 4 benefits from doing that. we'll go on to the next one. Could nasal nitric oxide help to mitigate the severity of COVID-19? The answer? I'll just read right here. Studies indicate that nitric oxide may also help to reduce respiratory tract infection by inactivating viruses and inhibiting the replication in epithelial cells. So they're inhibiting viruses, okay, right from the nose on down. So by mask, first of all the exterior things that you can be in, outside air, exercise, and all those things. Now you've got to masks. Now you got to nose. We're going to get down to throat, okay, and the lungs area. These are we're doing the first parts of this, right? You know, all around us, and then where these viruses enter, okay, and come into the lungs, we're taking care of all of those with these initial steps, okay. Now, what else can help with here? I've tried this thing I have something called Oregano, which is oil of oregano. I put 1 drop in each nostril, okay, and I put it in there, and it can make your eyes water a little bit. My nose likes it, but I notice about 10 to 15 minutes after I do that, it just clears up everything in my sinuses. In fact, I have to blow my nose, and it smells and makes my whole system open, and it has a potent sort of antibacterial, antifungal, and I'm assuming also antiviral action. Like many spices, oregano does have some antibacterial, antifungal process. You know that thyme has that too. In fact, a lot of the natural hand sanitizers are thyme oil, geranium oil, and there are other kinds of oils that have this same kind of effect. Oregano I use for the nose. So that does have some prophylactic effect. Again, none of this is considered straightforward medical advice. I don't want to get into that position. I'm just bringing this stuff together in a more consolidated and integrated way for you to evaluate. I also take zinc lozenges, elderberry lozenges, okay? Okay, got past my nose maybe. Now it's going down into my throat and I don't want it to get down into the lungs. Zinc elderberry lozenge has antiviral properties, okay, to create, again, another barrier for too much of it to get down. By creating these gateways all the way through, we are limiting at every step the development of COVID-19 and the access of the SARS-CoV-2 virus. So in 2004, a randomized trial of 60 adults with flu-like symptoms who took 50 milliliters of elderberry syrup 4 times a day saw symptoms clear up on an average 4 days earlier than those who took a placebo syrup. You will often see elderberry medication combined with zinc. Zinc has several studies showing that if taken within 24 hours of cold symptoms, which are coronaviruses, by the way, can reduce length and severity of said viral illness. Pooled results on children taking zinc, 10 to 15 milligrams daily for 5 months showed a decreased incidence of the common cold. So it does seem to have antiviral properties. If it directly connects some of the virus sitting around in your throat that's made it past your nose and you don't want it to go to your lungs, could potentially have some kind of prophylactic or preventive effect there. Now let's get into some of these vitamins that seem to have antiviral properties. Vitamin C has been proposed and is widely taken to help with various colds and various diseases. There have been various studies, some of them showing to be more effective and some of them showing not to be as effective, okay? And some of them may or may not be as effective because it's a water-soluble thing and we have a lipid layer around our cells. So a lot of what they're talking about here is that it may need a transporter to get it past. This other one shows what that transporter may be. Fight flu and cold season with 5 liposomal powerhouses, okay? It says that vitamin C is not to be overlooked at any point. It basically, here's the reason why it says that. It says studies have shown that healthy individuals are walking around with a morbidity index of around 14. About 95, for those that have the morbidity index about 14, about 95% of the vitamin C in their bodies is in the antioxidant reduced form. In contrast, those who were critically ill but survived had a morbidity index of about 1, huge drop, and while those who died had a paltry 0.3, 1/3 basically to 1/2 index. No wonder then that vitamin C in high doses gives intravenously along with thiamine and cortisone has been shown to help reverse and effectively treat deadly sepsis. Now, one of the things that's important, a lot of people talk to liposomal vitamin C versus regular vitamin C, is that lipoic acid and lipids can help support and transport that vitamin C through the cell. So a lot of times people say, take the liposomal form of the vitamin C if you really want it to have the effect that it's meant to, especially when you're in the throes of some kind of disease, cold, or in this case, even COVID-19. They go ahead and mention a few of the other ones, cat's claw, glutathione, and of course, vitamin D. I won't spend a lot of time with that in this particular article. Here's vitamin D. Vitamin D has been showed, and as I said here, new studies conclude that vitamin D can reduce your risk of developing COVID-19. Some new studies are even showing that it can reduce up to a third your transmission of it, as well as decrease the severity of the illness. Again, a lot of this happens because this COVID-19 messes up our system such that it draws out and creates vitamin D deficiency. Since so many of us are indoors and going at computer screens, all of that reduces our vitamin D level as well. So it's important to supplement or find a way to get that into our system to help boost it up. It says here the best way to get vitamin D is through sunshine and healthy meals, but supplements can also be used. I do use a vitamin D supplement, again, for myself. I'm not recommending it necessarily to anyone else. I'm just trying to put the research forward here. Vitamin D is a well-known immune booster here, it says. Now, a series of recently published studies say that supplement can also protect you from contracting Sars Cov2, the virus that can cause COVID-19, and vitamin D may reduce the severity of illness if you test positive. There's been some pretty extensive research on that, and vitamin D is in most even mainstream protocols when it comes to dealing with this because of the way the disease can create vitamin D deficiency. So, and definitely there have been found a link between vitamin D deficiency and developing COVID-19, including mortality or death and hospitalization. So it's very, very critical. I mean, so much so, it's very, very dramatic. That some of the levels that were observed with and without vitamin D when it came to especially the most dramatic cases. And this was understood fairly early on. So now we're here. Can vitamins protect against COVID-19? I want to create a little bit of balance here. There are some mostly more mainstream scientists who believe that really vitamins are only important insofar as they deal with deficiencies. In other words, they don't feel like it's going to actually add a lot, but it's going to help your body not deteriorate as much, especially diseases that sap vitamins out of your body, especially vitamin C or zinc or vitamin D, for instance. And they also caution that taking too many of these vitamins could have a deleterious effect. What are some of these nutrients that have come out? Zinc, melatonin, vitamin C, vitamin D. Those are the ones that have begun to study. And they do have some clinical and other kinds of evidence of support. So let's go here. They mentioned melatonin. Melatonin, not only, most of the people, you know it from sleep. So, helping as a sleep aid. But melatonin also has a powerful antiviral effect as well. And again, if you notice, it's not just blood and immune system that we're dealing with here, but also nerves. We're cranking up sympathetically our nerves, our anxiety, our level, like we're going to actually get into some kind of battle or long-term stress because we don't know when the virus is going to end, or we're going to get a vaccine or not get a vaccine, or whether that vaccine is going to work. Melatonin helps that calm down, but it also has interesting antiviral implications as well. And let's look into that. Here is an article from Cleveland Clinic talking about melatonin. And many of these things from well-known clinics and also peer-reviewed publications. Here's the relevant paragraph here. Melatonin usage may help prevent COVID-19 infection. Analysis of patient data from Cleveland Clinic's COVID-19 registry also revealed that melatonin usage was associated with nearly 30%, that's almost a third, reduced likelihood of testing positive for SARS CoV-2 after adjusting for age, race, smoking history, and various disease comorbidities, things that contribute to death and hospitalization, so forth. Notably, the reduced likelihood of testing positive for the virus increased from 30 to 52% for African Americans when adjusted for the same variables, to almost half, or more than half, when it came to African Americans when adjusting for the same variables. So melatonin has an extraordinary statistic and research connection with limiting not just your reactions to COVID-19, your SARS-CoV-2, but from testing positive at all. Very powerful data there. Now, be well, a potential role for vitamin B. Vitamin B is very interesting, especially the vitamin B3. I've talked about this in my other videos, and I'm just going to say a little bit here because I'm trying to create a comprehensive video here. Oh my gosh, we're already up to 40 minutes. Okay, well, when you have this much information, I'm trying to move along quickly. Anyway, vitamin B and the various vitamin Bs you can see in this photo hit different aspects of viral invasion, replication, cytokine storms, and so forth. But the most key one that I'm finding is niacinamide or nicotinamide, okay? This one acts as a building block of NAD and NADP, both vital during chronic system inflammation. And that's really what's key. COVID-19 rises and falls on inflammation and the ability to manage it. It acts as a coenzyme in various metabolic pathways. It's released during the early stages of inflammation and has immunomodulatory properties known to decrease the pro-inflammatory cytokine storm. Very key. We're noticing a theme here. Recent evidence indicates that targeting the IL-6, interleukin-6, could help control the inflammatory storm in patients with COVID-19. So very, very critical in that, not letting it simply take off and build on itself. Moreover, niacin reduces neutrophil infiltration and exhibits anti-inflammatory effect in patients with ventilator-induced lung injury. And hamsters it prevents lung tissue damage. In addition, nicotinamide reduces viral replication. Nicotinamide reduces viral replication. I do take nicotinamide as well. It's the same as niacinamide. It's the intermediate form of vitamin B. That's one of my main ones, along with vitamin D and a food source multivitamin. Again, why food source and why organic multivitamin? Because those have trace elements that can help all the other vitamins work, okay? Maybe it needs a little iron to work, and maybe it needs a trace element that's in that food source multivitamin, organic, of course. And that by having those together, along with the probiotic, we'll talk a little bit more about those, okay? Definitely vitamin D, vitamin C, omega-3s to help, again, bring the mood down, help for that relaxation, and a few others. So let's learn a little bit more about this. Inflammation seems to be really much the theme here. What's another thing that can help with inflammation? CBD. CBD, unlike THC, okay, it does come from pot, but it's the non-narcotic form of pot, okay? And it has these really intense anti-inflammatory effects that seem to have implications for COVID-19. As it says here, in a new study, scientists have shown that one of the non-psychoactive cannabinoids in cannabis, CBD, reduces lung damage induced by cytokine storms caused by COVID-19 through enabling an increase in levels of a natural peptide. What is this natural peptide? Apelin, okay? Which is an important regulator in bringing both blood pressure and inflammation down, drop close to zero. Now, when again, remember, when you have acute respiratory disease syndrome, okay, it's really cannibalizing so much of the enzymes and the nutrients in your body to deal with it. What happens with CBD, it comes in and helps to fortify this very important aspect, protease that helps to modulate that. Okay, this apelin, which got low, was increased 20 times with the introduction of CBD. When blood pressure gets high, for example, apelin levels should go up to help reduce the blood pressure. Again, it's these calming things, okay? It should also do the same to help normalize inflammation in the lungs and related breathing difficulties. So much of the deaths and hospitalization and the damage from COVID-19 has to do with creating a runaway inflammatory response. You notice all of these are helping to fortify the nutrients to help create a balance and equilibrium within the blood and within the breathing and within the lungs. And it helps to lower inflammatory responses. We're going to see why that's so important here in just a few minutes. Okay. How about furin? Okay. Now, not all the things I'm talking about have to do with things that you can do yourself. Some of these have to do with various drugs that are out there. We have some study around. Once the virus has gotten into your nose and all these things that you've used, you've used sunlight, you've used everything to be in environments that the virus can't survive in. Then you've used masks and some physical things, oregano in your nose, nasal breathing, zinc lozenges, they help prevent that virus from getting down in your lungs. You've done these other things that help limit inflammation in your lungs and limit attachment in your lungs of this thing, okay? Now this virus has gotten to the point where, let's say that it's gotten to the point, we'll talk about ACE2 receptors as well. It's attached. Okay, it's trying to find a way to get into your cells. That's where the furin cleavage site comes in. Okay, and apparently, and again, this isn't an over-the-counter medication here. Something called diminazine is a competitive inhibitor of furin. That means this furin cleavage that the COVID-19, the Sars Cov2virus bug is using to try to get into your cells is inhibited, so it can't get into your cells as well. Okay, I'm probably jumping ahead here because I need to talk about ACE2, okay, before this. But this interrupts that state, okay? A reason for the high infectivity of the SARS-CoV-2 is a furin cleavage site in the spike protein, that one you keep hearing about. It's a potential therapeutic target. So in other words, if we want to help interrupt the chain, we find out what it attaches to. We already talked about attaching to the lungs and the epithelial lining. It also attaches to ACE2 receptors. We will talk about that. And then once it does that, it tries to get into the cell using this furin cleaving site. If you can get something to bind up with that furin, it can't cleave and get in there. And apparently, diminazine is one of those things that can actually help with that. Okay. In fact, what is its effectiveness? It says among them this is an NIH article. Among them, the anti-parasitic drug diminazine showed an inhibition ratio of over 95%. So real promise in mucking up the SARS-CoV-2's ability to cleave and get into a cell. Okay. And this is, again, I'm going all the way back up again, another peer-reviewed publication, Science. And let's talk about another substance. Now, these are a little bit out of, it looks like a little bit out of order here. But quercetin is also another substance that can help with inflammation and immunity. Okay. These first lines put it that in vitro and some animal models have shown that quercetin, a polyphenol derived from plants, has a wide range of biological actions, including anti-carcinogenic, anti-inflammatory, and antiviral. What's quercetin and where can you find it? Is the flavanol, okay, found in plants. They call them phytonutrients, and it usually has to do with the colored parts of the plants. Here are some of the common foods with quercetin in it, or quercetin: grapes, berries, cherries, apples, citrus fruits, onions, buckwheat, broccoli, kale, tomatoes, red wine, and black tea. Again, just another thing in your repertoire here. And there's another thing here as well, that once it does get into the cell, let's say it got past the furin cleavage site and it's trying to get into your cell, and that's where it replicates. That's where the SARS-CoV-2 replicates. What we're now finding is that chemical compounds in green tea, dark chocolate, And muscatine grapes, and that's another thing I take is a muscatine grape extract along with my other things, can actually get into the protease. I'll just read it right here and prevent that replication from happening in the cell. So we now have another way we can stop this virus. Once it even gets past the furin stage and into your cell, these substances can prevent it from replicating in the cell, the Sars Cov2 virus. Here's what the research performed both computer simulations and lab studies showing that the main protease in the Sars Cov2 virus, called MPRO, reacted when confronted with a number of different plant chemical compounds known for their potent anti-inflammatory and antioxidant properties. MPRO in SARS-CoV-2 is required for the virus to replicate and assemble itself, Z said in a press release. If we can inhibit or deactivate this protease, the virus will die and not replicate within the cell. The computer simulation showed that studied chemical compounds from green tea, 2 varieties of muscadine grapes, cacao powder, and dark chocolate were able to bind to different portions of the MPRO. So again, at every one of these stages, we have natural and some of them more medicinal and more medical or pharmacological that would require a doctor's intervention, but many of these things are available to us. Again, none of this is medical advice, and most of the people say, don't do your research. But by bringing the information around, we can actually have a ground from which to ask questions, consult qualified health practitioners, and understand how our own bodies work. Understand the risk of taking, if there are any at all, and the risk of not taking them, if there are any at all. So again, this is trying to bring this together in one place. Probiotics, another possible solution to COVID-19 transmission. What are probiotics? Probiotics are those beneficial bacteria that can actually help your system work together. We have found with recent research how much the gut is its own brain, it's its own ecosystem. With a healthy gut, not only does your digestion work, but your immune system works as well. And more research is showing that. In this particular article, this is a quote by a medical doctor or a medical researcher called Paul Wiskmeyer. He says, we have data studying benefit of probiotics in animals with infections that resemble human infections, such as pneumonia and abdominal infections. If you give probiotics at the time those infections start, there's much greater ability to clear the infection, thereby reducing the spread of these infections in the body and allowing those animals to survive at a much greater rate. We found that this occurs through effects that probiotics have on the body, ability of the body to clear viruses and bacteria, and regulation in the way we respond and control inflammation. Bingo, inflammation coming up yet again. We're finding that to be the key indicator of some imbalance, and something that can reduce that inflammation or create balance or equilibrium. It begins to, quote, if not cure the condition, manage its response. For example, we know that COVID-19 leads to a high inflammatory state, injuring the lungs and other organs. Our data indicates probiotics may reduce that inflammatory injury and help the body resolve the inflammation. Wow, a lot of stuff here, but again, creates a bit of a checklist, and I wanted to get it all in one place. Now, I put ACE2 receptors a little bit later because they kind of join up with the very last part. And that is, let's say you've gotten all these down and you have even your viral load going down. COVID-19 still throws you a curveball. Some people are dying 19, 20 days after their initial onset of symptoms. Some of them have even gotten out of the hospital and then they drop dead, and people are like, what's going on? They seem to go through the worst part. Well, there's something about COVID-19 that doesn't follow other viral infections. Other viral infections have a profile in which the symptoms, the number of antibodies, and the spike of so many of these inflammatory responses all happen at the same time. For some reason, COVID-19 has viral loads fall off, but inflammation kicking up sometimes quite a bit later. And we're like, what the heck is happening here? Right? So there's something called an ACE2 receptor, an angiotensin converting enzyme. Now, this is really confusing because if you do with the Arabic numeral 2, It's the good thing. It's the thing that can kind of bring inflammation and balance to the point. If you don't have that, the ACE2 with the Roman numeral 2, like the two eyes, takes off and keeps going, becomes uncoordinated and unregulated. And that creates an inflammatory reaction that can be fatal. So as we go down there, these ACE2 receptors are very important at regulating that, and it's also the site where these viruses attach in the lungs and in the endothelial lining. These ACE2 receptors, they inactivate these things, creating uncontrolled inflammation, but they also help them replicate and make their way in their bodies. So it's kind of a double whammy, okay? So by finding things that compete with that virus linking up to your ACE2 receptors, not only will it not give them something to attach to, which is also very important, keep them from getting in your body and getting a foothold, but also it will allow that ACE2 regulation, downregulation of inflammation to also happen. So we need to find things that kick out the COVID, not let them attach to your ACE2 receptors, and actually help the ACE2 receptor do what it wants to do better. And so that's what we're looking to find as we look through this. Here we have. This is the way it's explained here in this scientific paper. Thus, functional ACE2 normally expressed by alveolar epithelial cells, okay, that's in your lungs and the lining of your lungs, can be viewed as a critical survival factor for these lung cells. Without that ACE2 normally expressed and regulated, a lot of your cells can die, lung cells. In addition, the enzymatic product of ACE2 itself protects against lung cells death by antagonizing the actions of angiotensin 2 or ANG2 with the Roman numeral, right? The Roman numeral 2, okay? And it keeps it from basically taking off, okay? And inflaming too much. And again, I'm not explaining this exactly scientifically correct. I'm sure there are scientists out there who can say, listen, you're not exactly doing that exactly right. The basic thing is this. It can help preserve the health of the alveolar cell, and it can keep the chemical reactions that are going there from becoming too inflamed and then therefore too damaging. Here's another thing. Now, what can help this? What can be something that can compete and increase the ability of that ACE2 receptor to do its thing, okay? It was postulated that the supplement, and I do take this as well, nicotinamide, also called niacinamide, the intermediate form of vitamin B3, may resist viral infection through innate immunity. Sars Cov2 infection can strikingly dysregulate the nicotinamide adenosine dinucleotide gene set, the NAD gene set, okay? And this family of enzymes required for innate immune response. Overexpression induces a significant decrease in NAD, all right? And by making sure you have enough of it, that can restore antiviral functions to support innate immunity, okay? So again, one of the things that can help, at least this is talking about, again, supplements of nicotinamide can help resist viral infection through the enhancement of innate immunity. One of the things we know here is that kids are doing so well on this. In fact, these vaccines aren't even approved for anyone under 16. So few of them are dying. By mid-July, 25,000 of these kids and children under 18 had been tested positive for COVID-19, and not a single one had died. Something about the innate immune system, a good functioning innate immune system that is much stronger in the young, seems to be playing a huge role in fighting this off better than acquired immunity, which not only is less effective, okay, but oftentimes there's something about it getting dysregulated, creating inflammation and even causing kind of autoimmune response and inflammation, and sometimes death, especially when a person's health and underlying conditions are not supportive of a robust response. So here we are, and this is what it talked about. What we're finding here, so much of the keyword is inflammation. What we're finding here is that we can't just let all the COVID-19 virus tends to hijack at very key points, our body's ability to regulate, not only in terms of our lungs and our blood, our immune system, cytokine storms, etc., and even our nerves in terms of this anxiety and hyping up and not being able to calm down. So as a general rule, we want things that integrate, balance, support nutrients that get consumed by this uncoordinated immune response, and help to integrate and bring together viral load for proper response, and not allow that immune or inflammation response to happen afterward. Okay, so that's what we're looking to do. And here's a little bit more explanation on that. Scientists are still debating the mechanisms of the storm of cytokines released by innate immune cells that contribute to the severity of COVID-19. But the new study may explain how it occurs in at least some cases. Quote, if you kick off an innate and adaptive immune response pretty quickly, you're going to be fine. But there's a deficit of the adaptive arm's T cells. The antibody response and the cytokines by themselves often have trouble containing the SARS-CoV-2, allowing the virus to grow to high levels. The innate immune system responds by pumping out still more cytokines. It's trying to keep up. Maybe the virus gets so far ahead in those people that it's too late for the adaptive immune system to catch up, he says. I'm not sure I agree with that, because if that were the case, then kids with a much stronger innate immune system would seem to have more of an issue here. There seems to be something about the adaptive immune system trying too hard, okay, causing an inflammatory or almost an autoimmune response. And because it's becoming uncoordinated, because it's sucking all these enzymes and nutrients, or it's not being able to have the proper ones to modulate that, is creating a breakdown. Now, when that breakdown is happening, and we're past all these different gateways, the nose, the throat, the lungs, the ACE2 receptor, the furin cleavage site, and finally the replication within the cell, when we're past all those, we have these higher viral loads, and we're not even past the viral load. We still have the problem with inflammation that can shut down the body even 3 weeks afterward. So this is where cortisoids like dexamethasone have come in, because when it gets to that late response, oftentimes you have to tamp down the immune response. You don't want to do it at the beginning, because that would disrupt your ability to limit the viral load and to do the front end approach on it. But toward the end, when you have an uncoordinated immune system and it's just firing off things, cytokine storms and inflammation, you may have to kind of force it down so that it doesn't rip your body apart, create an autoimmune or inflammation response. So again, that kind of, we've seen every single step here, and we're trying to treat this as a total system. Okay, so here we are. I'm trying to, we got it back to this. Trying to treat this as a total system. I talked about, I had to do a little bit of an edit there. Okay, so again, this talks a little bit more again. Ivermectin is another substance. Again, this is not something you can just take over the counter, that has seemed to have some kind of effect on people's ability to recover. Again, this is more of a therapy. This has reduced markedly anosmia and hyposmia. Those are the ability to smell. Remember, that's one of the things that is very common within COVID-19. That's one of these more distinctive things. And again, if you notice, it tends to lower viral loads and lower immunoglobulin G titers. Again, that's that more inflammatory thing at the end. So again, you notice these therapies have to do more with a kind of triage approach. The more naturopathic stuff has to do with that warm, rich environment that helps to really solidify and create a good foundation for you and me. So as we go on, this is one from Veg News talking about things we've already talked about, the dark chocolate and so forth. Let's see if we what else we have here. Here's one I wanted to, it was important here because this shows you how this virus is different than other viruses. Now, many of the same viral properties, a lot of the same nutrients can work with this one. But how is COVID-19 and specifically SARS-CoV-2 different? I'm just going ahead and read it. says, why is timing an issue for dexamethasone? We talked a little bit about this. If anything is clear is that little in the trajectory of COVID-19 resembles that of previously described respiratory illnesses. Unlike MERS-CoV, for example, SARS-CoV-2 is seldom found in blood during the symptomatic illness. Now, this is really curious. Even in people with severe disease, that is, that actual virus is seldom found in the blood during even severe disease, unlike others. In influenza, viral clearance is usually associated with resolution of symptoms. In other words, viral load goes with symptoms. Okay? In patients with COVID-19, however, hypoxemia can occur just as the viral load in the upper respiratory tract is disappearing. In other words, you're getting rid of the viral load, and yet your blood oxygen level is dropping. So it's creating a deficit here that is robbing your blood of the ability to actually transport oxygen and to keep the level up. As we've noted in other respiratory diseases where I'm reading on here, ARDS, acute respiratory disease syndrome, tends to occur in the early days of the virus illness as the innate immune system responds to the infection and lung tissue inflammation begins to rise, that initial response. In COVID-19, however, ARDS appears to occur much later during the adaptive immune response to the infection, when a specific antibody against SARS-CoV-2 begins to appear. Now, that was the immunoglobulin G that we talked about just in the last frame. In other words, by the time ARDS begins to occur in patients with COVID-19, the viral load has begun to wane, and patients are paradoxically requiring respiratory support after the viral load is done. This delayed ARDS phenomena is unique to SARS-CoV-2 and likely explains why patients in the recovery trial treated early with dexamethasone, the part you don't want, right, to tamp down the immune system, it doesn't really benefit them, but it does in the late because that's where the tail end inflammation happens, and that can be even more dangerous than the disease, especially after the viral load is already going down. So now we're at the next one, and I just wanted to do this graph which shows you even 20 to 22 days how much these antibody responses have gone up, even though the viral loads have gone down. Again, it's creating this disequilibrium. And finally, I wanted to provide this page for others, people who are not able to take supplements directly, either because it's hard to swallow them, right? Or they have problems digesting them. Okay, I know a lot of people like that. And they're older, perhaps. These actually, just like with nicotine patches and birth control packets, can slap right on the upper chest or the shoulder and deliver those nutrients in a time-released way right through the skin in a way that doesn't interrupt with a lot of the organs and so forth. So for those of you who find those other ways more difficult, you might want to research into topical patches that deliver nutrients and these supplements. So let's go ahead and just wrap this up. Here's the thing that this is showing us. Just as that last thing showed us, this SARS-CoV-2 is not typical. Okay, in so many ways, it doesn't follow the same track. It's a respiratory virus, but it's also a blood, immune, nerve virus. Okay, it interrupts those things. It's a fairly comprehensive virus. It interrupts a lot of enzymes. It oftentimes can suck in and require a lot of subsidy in terms of supplements because it dysregulates and causes imbalance on so many levels, thrombosis with blood clotting, restriction of blood vessels. Everything that is about us that is keyed up, that is a sympathetic response, that is a fear response or is a active response, it's asking for us to find a way to address this challenge, but still gear our body down, gear down the inflammation, gear down the fear, gear down the anxiety, find ways to create a nice, solid, strong foundation without an active and overactive, over-inflammatory response. It's teaching us to be members of a biome, just like our gut biomes have this or act best when they have this very vital and diverse environment, much like a rainforest, okay? The approach to this COVID-19 is requiring that same kind of diversity. Just like a stock portfolio has many different stocks. If any one of them fails, okay, we have a problem or a breakdown or a failure. If we just have a few things that we're using, we're going to be in a lot more trouble than if we have a much more diverse surrounding system that can encompass and buffer any insult in any one part of that environment. So this is the lesson for us. We are complex, but the proposition is simple, okay? We have to have an integrated, comprehensive, collaborative approach. We have to reach equilibrium and accept this challenge as a way for us to learn how to participate in equilibrium. And I'm willing to take on that challenge with SARS-CoV-2. I'm willing to see the wisdom in that and to be able to make choices that integrate even things like vaccines and various therapies with these other naturopathic ones, including even physical things like mask wearing and social distancing. We don't have to get into a camp. And I would suggest that we do not. Look at the science, but not just scientific materialism. Look at what nature itself is offering us. Look how these things work together to provide us the basis for the best holistic approach forward. That, I think, is the lesson for each of us. It's not only going to work with our health, it's also going to work with the environment and our duties to the environment. It's also going to work financially. It's also going to work culturally, as we've seen so much breakdown in truth and breakdown in with various politics and so forth. If you notice, in each one of these areas, when we have tried an adversarial, aggressive, simplistic approach, one that doesn't involve complexity and surrounding and collaboration, we are failing. But when we do that collaborative approach, when we allow for that complexity with the simple understanding of holism to help organize that complexity and get all hands on deck, then we do well. So I think this is an invitation to our collaboration. I think this is an invitation to a real evolution going forward. In some ways, I didn't ask for COVID-19. I didn't ask for SARS-CoV-2. It may have come from a lab as well, but whatever its source, we are here to naturally deal with it. We are here to holistically deal with it. We are here to collaboratively deal with it. And we're finding out that works best. So I hope we take on this challenge as a way to step forward in our own evolution, our own cooperation and collaboration, not only with each other, with our own bodies, but also even with this virus itself and the many challenges to come in the future. Instead of looking for a quick fix or a technological miracle, let's see the miracle of our own bodies and our own cooperation being the way we go forward. So I hope that's been helpful to you. Again, please click on the subscribe button or the bell if you want to be notified by similar videos. There's also even a PayPal link on my main YouTube page if you want to donate for some of this research. It's a labor of love for me, and I hope it's been very helpful for you. Until next time, this is Dr. Zeus signing off. Thanks.